I am going to give an overview of what causes ingrown toenails. I'm going to use my thumb because it's a whole lot easier than using my toe. The result or the cause of ingrown nails are typically because a person has trimmed the nail way too low. So they get this corner that is supposed to be there, this little white edge is gone because they've trimmed it too low. For an example, I'm going to use this thumbnail as an example. They will trim it way too low like that to get the edge gone, because with either their running shoes or point shoes, as it presses on, that corner gets pressed on and it creates a friction point. And sometimes the nail will actually crack there. And so they trim the nail down too low. Now, instead of the nail being lifted so that the edge has got plenty of room without skin rubbing up against it, they've trimmed it too low so that the skin here wants to roll up and push against this new cut corner or cracked corner. The problem is that this corner now has skin pushing up against it, especially if you've got kind of fatter fingers or toes. And I don't mean fat, I just mean wide, because a lot of people can have wide toes, but they're super skinny people. So what happens is the skin rolls up and pushes up against the corner here, right here. And we always have bacteria on our skin. That's normal, that's healthy. But when you have a sharp corner here, even if it's nice and rounded, the skin is pushing up against it and will break, just put tiny little cuts in the skin right along here and introduce bacteria under the skin. So what ends up happening is then this area here will get all red and inflamed and swollen and very, very tender. And so if you do anything like start running, putting on point shoes, going up on point, it will press on that and this whole area is inflamed and red and will really hurt. And so it'll be tender, you'll get pus draining out of it, and it can eventually end up causing a big infection here. Usually our body will fight it off and it'll be really sore for a few days until that nail starts to grow back out and resemble more like this one where you've got a good edge there. Now, so there's this balance of how far do you cut down that edge without causing the skin to roll, and letting it be long enough so that it stays healthy, but letting it be short enough that it doesn't impinge on your point shoes. And so my recommendation is to kind of cut the nail just a little bit so that you've got a little bit of an edge still there so that you can get back up on point. And up here, the middle part, you can go very low if you need to. So you can go much flatter here, which is often a little bit easier when you're on point, but keep a little bit of a curve here and try to keep a bit of an edge here that you can get a fingernail up under the edge here. The more that you have space here that your toes can tolerate it when you're on point, the better and easier it's going to be for you, or the less chance of this getting an ingrown toenail. There is an idea that ingrown toenails are like, I'm going to draw it down here, that the ingrown toenail is actually kind of growing like that. And that's not actually the case. It's because we've cut it too low, and then the point that is hurting is right here. And so sometimes people cut it lower and then it hurts down here, and they cut it lower and then it hurts down here, and then next thing you know, this whole area is inflamed and painful. So what do you do if you end up having an ingrown nail? The biggest thing is you got to let that nail grow back out and try to get it back to a point where you have got a white edge there, running along here. But in the meantime, if you did cut it way too low, or it cracked and it cut too low and you got it ingrown or swelling along the side here, you can just get your fingernails up underneath the nail that does exist and try to lift it up. And so I'm actually going to just be pushing up here just to get some leverage under there, and it starts to alleviate the pressure. So I am, if that's the nail kind of coming on the side here, I'm just putting pressure up here so that I'm getting more space under the corner of the nail. Some people will actually tuck a Q-tip or a toothpick or a little roll of toilet paper, like just a little piece, up under the nail to lift it up and provide a little relief. Some people will actually take a piece of floss and run it, not just kind of keep it under the edge of the nail just to lift it up. Taking some hot baths or soaking in some warm water will also loosen things up and allow you to get a little bit more leverage under that nail to lift it up. And what will eventually happen is pus will often come out, but the pressure will relieve, and then you'll get that nice smooth edge here again, and the toe will heal up. So hopefully that'll help you a little bit if that happens. Keeping the nails trimmed so they don't crack on their own, but finding that balance for you and your toe is going to be really important to find out how low you can cut it so that it's comfortable with your point shoes, but long enough so that you don't get ingrown nails. Everybody's different. Everybody's got to find that balance. So hopefully that helps. Good luck.